Anita, how are you? Good to see you.
After facing criticism around a slow rollout, Ontario officials say it's now full steam ahead.
We're ramping it up, and you're going to see a significant difference over the next few weeks there.
Some working on the front lines have called it maddening that tens of thousands of doses are sitting in freezers when long-term care home residents are dying from COVID-19.
We have people who've raised their hand and said, we will do this 24/7. Engage us, please. And we're waiting for our instructions. We're ready to go. We just don't know what's causing the delays.
Across the country, provinces vow to pick up the pace. In Manitoba, healthcare workers lined up at a convention centre turned mass vaccination site. The province hopes to administer 10,000 vaccines a week by the end of the month.
I'm very excited. I'm hopeful more of the population can get access to the vaccine so that maybe there is an end in sight to this.
In British Columbia, the hope is to have 150,000 people vaccinated by the end of February.
It's a monumental task, and there are many months left to go in this.
Like elsewhere, healthcare workers, long-term care residents, and remote First Nations are the priority here. Last week, dozens were vaccinated on the Gitgat First Nation, which is a northern community on BC's coast.
The fact that we've been able to have access to the vaccine, been able to give it to majority of people eligible, it creates a bit of a sense of relief, feel a little bit safer.
But for some Canadians who have received the vaccine, there's still uncertainty around the timeline for the next round. Quebec is delaying giving some their second shot in order to give more people at least one dose now. It's disappointing for some families.
I was so hopeful and so excited about being able to hug my dad. And now that there's a delay in the delivery of the vaccine, I can't say that.
So, Briar, do any of these plans to ramp up involve expanding vaccinations beyond those priority groups?
Well, Adrienne, the provinces are really still trying to nail down just when and how the vaccine will be available to the general public. And in BC, Dr. Bonnie Henry says that's because they're still waiting to hear exactly how many doses they'll receive this spring. She added that if Ottawa approves more vaccines, like the AstraZeneca one, it would help with the rollout and with the federal government's target of having all Canadians give access to the vaccine by September.
All right, Briar, thanks very much. Briar Stewart in Vancouver.